Disease associated with food, Salmonella. What is Salmonella? Salmonella is the genus name for numerous types of bacteria. Salmonella is a rod-shaped motile bacterium. It is non-spore forming and is gram-negative. There is a widespread occurrence of this bacteria in animals, especially poultry and swine. Some environmental sources where this bacteria can be found include water, soil, insects, factory surfaces, kitchen surfaces, animal feces, raw meats, raw poultry, and raw seafood. Salmonella have been known to cause illness for over 100 years now. The beginning stage of diagnosis is first suggested by a recognized outbreak. Since diarrhea, fever, and abdominal cramps can be symptoms of many different illnesses, laboratory tests need to be done to identify Salmonella in the stool of an infected person. Most people begin to develop symptoms such as diarrhea, fever, and abdominal cramps 12 to 72 hours after they have been infected with Salmonella. The illness usually lasts 4 to 7 days, and the majority of people can recover without being treated. Sometimes the diarrhea can become so severe that the patient needs to be hospitalized. In these more severe cases, the Salmonella infection can spread from the intestines to the bloodstream and continue on to other body sites and can eventually cause death unless the person is treated with antibiotics. More severe cases are usually found in the elderly, infants, and those with weak immune systems. Usually the infection resolves itself and does not require any treatments other than ingesting fluids orally. People with severe diarrhea may need to be rehydrated with intravenous fluids. Antibiotics are not typically used unless the infection spreads from the intestines. Some Salmonella bacteria have developed resistance to antibiotics mainly because of the use of antibiotics to promote the growth of food animals.
Ingesting undercooked or recontaminated poultry or handling raw poultry can lead to salmonellosis, more commonly known as food poisoning. Salmonella is one of the most frequently reported foodborne diseases in the U.S., and poultry is a common vehicle. The mechanism of contamination initially involves retention of bacteria in a film on the poultry skin. The bacteria can be trapped in ridges, crevices, and follicles of the skin. Despite rinses, high populations of Salmonella can still survive. On farms, poultry feed is commonly contaminated with Salmonella, which increases the prevalence of carriers. Salmonella can survive in litter and soil. Poultry have a habit of pecking the ground and can ingest the pathogen. Rearing fowl in crowded environments can also increase rates of contamination. In processing plants, poultry passes through a series of operations. Contamination can occur from the environment, equipment, or cross-contamination from other birds. Despite the process of scalding, washing the fowl in hot water, pathogens can survive and recontaminate other carcasses. Defeathering can push microorganisms into skin tissues and resist removal during subsequent washing operations. The National Research Council even concluded that poultry inspection does very little to detect or prevent contamination of raw poultry by Salmonella. Salmonella can enter the food market and personal kitchens on chilled and frozen raw poultry, which is associated with drip and thaw water. If thawed poultry is left at room temperature, 20 to 25 degrees Celsius, or in a water bath for several hours, pathogens can multiply. Cloths and sponges can become contaminated when they are used to wipe water or drainage from pieces of poultry. This cross-contamination can spread pathogens to hands, surfaces, or other items in the kitchen. Vegetative pathogens that are still frozen are often insulated by stuffing. In food service operations, poultry is often kept hot on a steam table, within a temperature range that is conducive for pathogen growth.
How does salmonella get into the egg? Experts say that chickens carry the bacteria in their own bodies and pass salmonella along the yolk while the egg is forming in the ovaries. Chickens can also pass bacteria to the eggshell through the shell pores into the inner egg. Most experts say that chickens can harbor salmonella without being sick themselves. Salmonella can be transferred from the inside out or from the outside in. To disprove many consumers' beliefs, cracked eggs are not the main factor for the salmonella problem. A crack-free shell does not guarantee clean eggs. Any part of the egg can be affected, but the yolk is the most common source. According to the USDA, the most common mistake in foodborne illness were that eggs were served raw or undercooked, and a good example would be cookie dough. According to the FDA, the main guidelines help in reducing chances of getting the disease, but these practices do not eliminate salmonella contained within the egg. To ensure egg safety, eggs are recommended to be kept preserved in the refrigerator or cooked thoroughly. In 2010, an estimated 2,400 people have been affected by eggs, and more than 550 million eggs were recalled in August of 2010. Now, what is the initial reason for this bacterium in our eggs? If an animal is infected orally, the bacterium colonizes in the small intestine. Once in the small intestine, some of these organisms then invade tissues of the epithelium through M cells of specialized lymphoid tissues in the gut designed to give immune response. This is the exact place where initial infection occurs. For chickens, once a bacterium enters a chicken, the microbe thrives under ideal conditions, about 102 degrees Fahrenheit. Unfortunately, chickens experience salmonella without showing any signs of illness. The lack of symptoms in the chicken makes it especially tough on farmers to know which animals are infected, regardless if they're conventional, organic, or free range. Once ingested in one system, the microbes double every 20 minutes under ideal conditions. This leads to septemia. To slow down these prime conditions, people are urged to follow the FDA's eggs rules at a glance. Some of these rules are: knowing where your eggs were raised and how they were raised, knowing the environment in which your eggs were raised in, such as rodents, flies, or debris, and knowing the cleaning method of your eggs. Also, some other actions include eating eggs promptly after cooking, consider buying and using pasteurized shelled eggs, and discarding cracked or dirty eggs. According to the Centers for Disease Control, 1 in 10,000 eggs contain salmonella. If you consider most egg dishes are made with at least 2 eggs, that's 1 in 5,000 egg dishes that could potentially contain salmonella. Of course, this is a national average. As demonstrated by the 2010 egg recall, this risk could be higher in eggs that come from flocks and farms that are contaminated with salmonella. So, you might want to think twice next time about tasting the cookie dough sitting on your kitchen counter.